certainly is more of a time of reflection. And with people from Physicians for Global Survival, we often had more of a spiritual type of time, not in a Christian way, and I'm Hindu, but a time on Sunday morning for people to sit, reflect, share stories and experiences. At Transcending Borders, we had PEGASUS leading an interfaith type of event, and we had a Muslim imam and a Hindu priest. And I think that it's nice to think about these things. We've had a lot of frenetic activity, a lot of music, a lot of joy, and sometimes we need a little bit of peace and quiet, as we had in the hotel here last night. It was interesting that yesterday evening when Ziauddin was speaking, I could see this red light there, and I thought, well, what's the police doing somewhere across the street? And then I found out that we had the fire in the lamppost over here, right where I think we had Gina was parked right underneath there. But then we went through that and we survived that, and then in the middle of the night, those of us staying in the hotel had another event too. And so I saw Shawna's Facebook message this morning. She said, you know, basically it was, you know, I was sort of a bit concerned about airport noise and planes, but really that beats having smoke in the room right beside you, and we had the fire alarm go off in the middle of the night, and people were evacuating from there. And so I think that it wasn't as restful or a time for reflection as we might have wanted. But on the other hand, that was something that made us think about the realities of what some people have to go through, that we are disturbed by something like this, but other people have much more major disturbances in their lives. And those can be chronic disturbances, dealing with the issues of social marginalization and poverty, as well as some of the acute disturbances. Which brings us to this morning's panel that Shawna is chairing. We have two people whom we're planning to Skype in. The one, it hasn't worked out, but we have a video of his. And the other one we should have. And we also have Kathy Bergen here, who's not on your program, who has worked in Palestine for a number of years, well, Israel-Palestine, to primarily in the West Bank, but she will tell us about her experience. She was connected with Hatim, our speaker from yesterday evening, speaking about Israeli Arabs or Palestinians on the one side of the Green Line, and she is also connected with Mustafa Barghouti, and she was on our peace stream of our conference, so she'll say a few words, but I'll let Shawna introduce the other speakers, and should have two empty chairs for our others here. So Shawna Ahern, who's the director of the Global Health Office at Dalhousie University, a lot of international experience, and also with the Canadian Coalition for Global Health Research. So I'll let her take over the chair this morning.
Thanks, Neil. He did a great introduction. I don't have to do as much now. So good morning, everyone. And it's been a really exciting couple of days, and I think Neil gave a good overview of some of the key elements of it. And I was asking some folks last night and even this morning of what they found to be so rewarding. And part of it is, I think the piece that Neil just talked about is this sense of community. And you know, if with all the people that are here, we probably all represent and live and work in different places. And in that case, we tend to feel a little bit isolated. So having the chance to come together, to be with like-minded individuals and to sort of to be recharged has been an empowering piece of the past couple of days for myself, and I heard reflected in many of your words. So I'm looking forward to continuing those discussions this morning, and looking forward to being recharged when I get back to the office on Monday. They're always a bit worried when I come back recharged because they don't know what that's going to mean for their work. It usually means new projects. So we're going to, as Neil mentioned, we have an interesting panel because some of this is the use of technology, and our first person is going to be Richard Wilkinson, who is unfortunately unable to join us today, and he just had an emergency call and is not able to join us later by Skype or phone to answer questions, so he sends his regrets. Many of you know of Richard. He's co-authored a book, The Spirit Level, and he's also co-founded the Equality Trust, which is a nonprofit striving to reduce income inequality by educating and engaging the public while supporting political commitment to address the various problems. And he's done such a fantastic job of demonstrating that societal well-being bears no relation to per capita income, and has really talked about how we can be happier and healthier individuals, but also societies. So I think, is it ready to go? We'll just let him, the thumbs are up from the magic men in the booth over there. So we'll just let it go forward, and we'll come back and to the next speakers after.
I'm sorry not to be with you at this conference. I would have liked to have been. I've enjoyed all my trips to Canada. But anyway, I'm recording this from home in England. I'm going to talk about the effects of inequality on a whole range of outcomes, including health. The first slide I've got is really just to remind us of the mismatch between the unprecedented levels of comfort and plenty and so on in our rich developed societies and their many social failings. This is a slide picture of people in the prime of life going to work in central London. Everyone there looks miserable, depressed, anxious, fed up. You know, there really is a mismatch between our material standards and comfort and psychosocial well-being. On my next slide, you can see the relationship internationally between life expectancy up the side and national income per person along the bottom. And what it shows is very rapid rises in life expectancy in the early stages of economic growth, and then it levels out and that relationship is lost. On the next slide, I have a quote from Cutler, Deaton and others, showing that even if you look at changes over periods of 10, 20 or 40 years, you find just about no relationship between economic growth and life expectancy. I think that's a very important pattern, and it applies not only to health but to other measures of well-being. In a way, what it's showing us is that in the rich developed countries we've largely got to the end of what economic growth can do for us. It is what's transformed the real quality of our lives. And yet it's largely finished its work. Happiness, measures of well-being and health no longer improve with economic growth. So in poorer countries, it's still really important to have rises in material standards where many people haven't got access to necessities, but in the rich developed world, having more and more of everything makes less and less difference. That's a crucially important point to remember. On my next slide, number 4, you see simply that relationship, but confined this time to the rich developed countries. And you see there's no suggestion of a relationship. However, we all know that within our societies there are extraordinarily close gradients between income and health. So on the next slide, you see data for small neighbourhoods in England and Wales, the poorest on the right with the lowest life expectancy and the richest on the left with higher life expectancy. These columns should all be a bit higher by now. This isn't such up-to-date data. But the point is, within our societies, income or something like it is very important. But between our societies, as I've just shown you, it no longer seems to matter. That's a paradox. The explanation of that paradox is that within our societies, on this slide, we are looking at the effects of relative income, or social status, position in relation to others. And as soon as you've got that idea that it's about relativities, you then have to start thinking, what happens if we make the differences between us bigger or smaller? And that's really what my work has been about. I took a whole range of health and social problems shown on this slide number 6. Ones which have gradients, more common at the bottom of the ladder, so lower life expectancy, kids doing less well educationally, higher infant mortality rates, higher homicide rates, more imprisonment, teenage birth rates, lower levels of trust, more obesity, more mental illness, and less social mobility, all at the bottom of the social ladder. So although there's depression and ill health at the top, and violence, they all become more common at the bottom of society. It is those problems that are sensitive to social status which get worse when income inequality increases. We put data, international data together for all those countries into one index. And on the next slide, number 7, you see how well countries do in that scale in relation to inequality. High scores mean countries do worse on all these kinds of measures. So on the right you see the more unequal countries, USA, Portugal, UK, with worse scores on all these kinds of things. And on the left, the Scandinavian countries and Japan, lower levels of income inequality, doing much better. But if you look at that same index of all those things, all weighted equally, but on the next slide, number 8, shown in relation to gross national income per head, you see there's no relationship. Exactly the same applies to the UNICEF measures of child well-being. On my next slide, number 9, you see the UNICEF index of child well-being. What it shows is that I think 40 different components of child well-being, which includes whether there's bullying at school, whether kids can talk to their parents, what immunization rates are like, all sorts of things like that. Standards of child well-being are lower in the more unequal countries. And you see there the contrast between most of the English-speaking countries doing badly, lower levels of child well-being, and again the Scandinavian countries doing well. Canada, in nearly all this data, comes somewhere in the middle. But once again, on my next slide, number 10, you can see that if you look at that same measure of child well-being in relation to national income per head, no relationship at all. So what all this data is showing you is that now in the rich world, it no longer matters what our absolute levels of living are. What now matters is something to do with social differences, social hierarchy, and the scale of income differences between us. So in effect, perhaps what matters is not how good your car is, but how it compares with others, and the same for other aspects of our material circumstances. I think usually when people think about inequality, there is a sort of view that perhaps inequality is important only if it increases poverty or is regarded as very unfair. On my next slide, number 11, I've shown, in a way, there are two views of inequality, and the more accurate is not simply a concern for poverty and so on, but actually inequality has psychosocial effects to do with our evolved psychology, feelings of superiority and inferiority, linking up to a sensitivity to dominance and subordination. On slide number 12, I have simply reproduced an abstract of a paper in Psychological Bulletin, which talks about the dominance behavioral system, part of our brain, and people have actually located the parts of our brain concerned with issues to do with dominance and subordination, submissiveness and so on, issues to do with rank and social position. But the suggestion is that issues to do with dominance and subordination have huge implications for a range of psychological conditions, issues to do with social anxiety, lack of confidence and so on, as people feel or struggle against feelings of inferiority, but also quite different responses, narcissistic behavior, forms of dominance motivation, where people try and talk themselves up and so on. So we need to think of inequality not simply in terms of absolute levels of living and poverty, but in terms of our evolved psychological sensitivity to issues to do with social status. If you like, what I think we're dealing with looking at income inequality, shown in my next slide, number 13, is really whether we live in a society with a really steep social hierarchy, social class hierarchy like that, or a much shallower one like that. And I think, in a way, the material differences between us create the social distances, and as I say, those feelings of superiority and inferiority. And the shape of the social pyramid affects social relations. As the next slide, number 14, shows, we've been aware for a very long time of how sensitive health is to chronic stress. Even low levels of stress have consequences for death rates. What has become clear over the last, I suppose, 10 or 20 years is how sensitive health is to stress from the social environment. On slide number 15, you see the results of a study which, it's a meta-analysis looking at studies in which people have been asked to do stressful tasks while having their cortisol levels measured in saliva or blood. And the meta-analysis was concerned to see what kind of stressors most reliably push up stress hormones. And they conclude it's tasks which include what they call social evaluative threat. And they say in the paper, threats to self-esteem or social status, where others can negatively judge your performance. So what gets to us are those worries about how we're seen and judged. And it's now clear from a range of data that in more unequal societies, where some people are so important and other people are looked down on and regarded as almost worthless, that we become more worried about social status judgments and how people see us. There is now a paper showing that status anxiety increases throughout the society where there is more inequality. So what do we do about it? On my next slide, number 16, you can see the trends in inequality in English-speaking countries over the 20th century. High inequality until, well, actually on some measures it comes down in the 1930s, goes on declining levels of inequality right through until around 1980, where you get the modern rise of inequality. I think that U-shaped distribution of inequality has to be seen in terms of the, if you like, first the strengthening and then the weakening of the whole labour movement. The power of trade unions, the strength of social democratic parties as a, if you like, countervailing voice in the media, whether people talking on television or articles in newspapers and so on, a different point of view being put. And I think that's largely gone, and so what has happened since about 1980 is the takeoff of top incomes, no longer constrained by any democratic element. And actually, as my next slide shows, that is, you can see close relationships between the strength of trade unions in different countries and levels of inequality. So this is an intensely political process. And if we're going to reduce inequality in future, we have to rebuild a movement, I think, not only around income inequality, but also around environmental issues. You know, greater equality has a lot to do with helping us to move towards sustainability. Basically, what I think we have to do is build in the democratic constraints on company directors and so on, which we've largely lost. So I think we need more legislation for employee representatives on company boards, which many European countries, unfortunately not Britain, which many countries already have, and companies with employee representatives on board seem to have smaller income differences within them. And countries with that legislation have had smaller rises in inequality since 1980. But I think we must also think about democratizing the economy more generally. Support for cooperatives, employee-owned companies. They have many advantages, and the studies now suggest that productivity is higher in those kind of companies. My last slide, number 18, shows what I think are some of the advantages and, if you like, the big objective for transforming our societies in the future, both thinking about inequality and sustainability. We really can improve the quality of life, but no longer by pushing up standards of material consumption, no longer through consumerism, but by improving the quality of relations, social relations in our society, which we know are so important for health and for happiness. So thank you very much. I'm sorry not to be able to tell you this stuff in more detail. Thank you.
It's difficult. I have lots of questions for him. Just a couple of reflections. I'm thinking over the past couple of days, a lot of what Richard was talking about has come out in his conversation, and I'm thinking Ryan Mayali's conversation around determinants of health definitely comes out in what Richard was talking about, and the challenge that we were given by one of our panelists at one point to start teaching the determinants differently and to engage particularly students in a new way of thinking of determinants. I think some of Richard's work would be interesting to explore and to go into more depth with him to see how we could be doing some of that. Hopefully we'll be able to have some questions and discussions afterwards, even if he's not here. Our next guest is joining us today from Okay. I'm not looking at Neil anymore. Marilyn McHarg is here from Dignitas. She's the president and CEO as of October 2012. She has an extensive history, as many may know, with MSF Canada, where she worked both as a nurse and medical coordinator and head of mission in multiple developing countries, including Uganda, South Sudan, and Liberia. And then from 2000 to 2006, she began to oversee the operations at the headquarter level, which oversaw over 20 countries. And she's a nurse by training and has lots of clinical experience, and as I've just mentioned, lots of management and leadership experience as well in global health and in the humanitarian area. So we're very privileged and honored to have you here with your experience, and looking forward to hearing your presentation. Thank you.
Good morning. I'll start off by saying that as far as conflict of interest, that I don't have any conflict of interests. As well, I'll just quickly touch on what I'd like to do in the next few minutes, and that is to make some observations about humanitarian aid. So I'm focusing in on the work that's done in specific environments, and the work that and the implications of that work, as well as far as getting the work done, but also what it means for the population, and spend a bit of time talking about what humanitarian aid is not. So what is it not, and then what are the implications of that and the meaning for populations. I see humanitarian aid as a very specific form of aid. It's the aid that is delivered usually in man-made and natural disasters. So it's aid that kicks in when there's been a huge disruption to normalcy and resulting in an acute crisis. Humanitarian aid is best placed, I would say, in war zones, in countries where there's extreme violence, and in places where there's massive oppression. In order to really succeed in humanitarian aid, I think that there's a number of principles that organizations need to really take seriously and use in guiding their decision making. And perhaps the most important principle would be impartiality. And having come from a medical organization that did humanitarian aid and still does, I'll focus in on the medical side. So impartiality from a medical perspective would really be about thinking about medical need and where is the greatest medical need. So it's about non-discrimination, but in a way that decisions are made according to need and pays no regard to ethnicity, to nationality, to religion, to anything that would potentially inhibit the flow of aid. So it's really about one human being helping another human being. And it's meant, in war zones, it's meant for all sides. And this is an important distinction, because when you start looking at what militaries do, they tend to focus in on one side of a conflict. Humanitarian aid is really meant to reach the people who are most in need, and that means being able to have access to all sides of a conflict. If I think back on Liberia and when I was working there, it's quite a small country, and during the war there were a number of different rebel groups, and what the international community would do and the aid organizations would do is they managed to negotiate access to all areas, and literally teams would be driving through different rebel areas to get to other rebel areas. And the negotiations were such that this was possible. And I think it really speaks to the importance of trying to function with impartiality, because if you can do that, then you are able to meet the needs where they're the greatest. In order to be impartial, there's got to be a very, I would say, a serious level of independence that's in place. there has to be an independence from political influence. There should be an independence as well from military bodies. Of course, in these environments, you're working alongside, but it should be clear that that the organizations are independent from these influences. Because without that level of independence, it's not possible then to make decisions on the basis of impartiality. In Médecins Sans Frontières, we would have countries where we would not take any institutional funds, so we would not take any governmental funds. And there was places like Somalia or Colombia. And the idea was that if a team member was asked by any party to the conflict, where were you getting your funding, and were you getting it from this government or that government, that the team could really step forward and say, no, we do not get any funding for this country from governments, it's all from private donations. And this gave a power to them, and it helped them to have a conversation about how we are or were independent, which allowed then for the potential of an opening to negotiate access to people on any side of a conflict. Unfortunately, humanitarian aid often gets confused with military aid in countries, and this can be for a number of reasons. It's very clear that a number of militaries now see aid as a way of winning hearts and minds. So they use aid, it's a means to an end, which means that its purpose is completely different. In humanitarian aid, it's about the end, whereas in military aid, it's a means to an end. And military aid, of course, is connected to political agendas, and it's also very much linked to these agendas in a way that is partial. And for that purpose, or that reason alone, it's important for humanitarian aid organizations and aid workers to try to make the distinction. A good example of confusion from the military side was in just after 9/11, the U.S. was bombing Afghanistan, and when they were bombing Afghanistan, they were dropping these cluster bombs that were yellow. And using the same planes but on different runs, they were also distributing food packages. And these food packages were also yellow. So if you can imagine, you have a population below, and they're trying to figure out whether that yellow thing in front of them is going to blow them up or it's potentially a dinner. It's just one example, but an example that helps to show that when aid gets mixed in that kind of way, it really creates a confusion for the population, and then that spirals for the aid organizations. The confusion is not only coming from militaries. I think non-governmental organizations will also feed into it inadvertently. When I was supervising one team in Democratic Republic of Congo, I was visiting them, and I noticed that the residence that they had chosen was somewhere where they could be safe, which is, of course, the most important thing, but it happened to be right by a checkpoint. And so I challenged the team, and I said, what do you suppose people think about that? And do you think that they really understand that that checkpoint is very much different from you, in the sense that you have nothing to do with it? It's coincidental that it happens to be looking like it's guarding your house. And it was an interesting discussion, because I think a lot of times aid organizations will make decisions on the basis of their own needs and perceptions. And there's a real need to step back and have a look at, excuse me, have a look at how others may be perceiving the setup that you have and the decisions that you're making, and be very clear about the distinctions. The bottom line is that in humanitarian aid settings, the environments are very politicized. And although the intention of humanitarian aid will be apolitical, it's pretty clear that in these environments, the aid itself becomes politicized. And it's important for teams, I think, to really know and understand this, because then you're able to minimize the impact that you can have in terms of the political side. When we were in southern Sudan during the famine in 1998, we had, a group of us had really put a lot of pressure on the international community and the World Food Program to distribute food. There was a need to really scale up the operations. And we were quite successful in getting them to push on getting more food into southern Sudan, which we thought was great. Unfortunately, there were different towns in South Sudan where when the food was being distributed, we learned all the women would come from different directions, and then they would receive the food, and then they'd all walk off in one direction. And it wasn't happening everywhere, but it was happening in some locations. And what we established was they were walking off to another distribution point where the military was redistributing their food. And somehow, I think what the aid world was doing was actually influencing the social echelon of that society. And what was happening in the second distribution point was reestablishing the hierarchy that existed, so that food was going to the military, to the wealthier, more established people, and not as much was getting to the people that it was intended for. So it's important in these environments to really step back and realize that even though the intention is apolitical, the impact can be, and it's by realizing that and being open to that possibility, I think teams are in a much better position to organize themselves in a way that they can minimize that impact. So humanitarian aid, if I were to say what the goal was for this very specific type of aid in these contexts, I would say that it's simply about saving lives and alleviating suffering. I say it's simple, it's not easy, but if the goal is really kept to saving lives and alleviating suffering, then there's a high probability that the impact on the population can be very strong. It's through doing that, I think that teams also give some space for choice, and also with that some space for people to hold on to their dignity. Humanitarian aid is reactive, and it's temporary, and it's important to see this. It's sometimes a blunt instrument, and I would say it's a Band-Aid. A lot of people struggle with the idea that that's what humanitarian aid is really about. But in these environments, it is what it's really about, and by seeing it that way, it can be more effective. Humanitarian aid is not about solving root causes in wars. It's not about capacity building or system strengthening as goals unto themselves. It's really, in fact, not sustainable. And I say that because if you look at sustainability, to have sustainability, you need stability. And you not only need stability in terms of peace, you need stability in terms of health needs. I mean, if you're in an environment where there's a lot of epidemics and there's a need for very fast life-saving activities, it's going to be very difficult to set up something that is sustainable. Sustainability not only requires stability, it requires having an authority in place that is really genuinely wanting to move a population forward. It requires organizations having very interdependent strategies with these authorities and aligning to these authorities in order to meet the goals. It also requires, I believe, setting a pace that allows for capacity building. If you then think back to working in war zones, quite often you do not have, you don't have stability. You quite often do not have authorities that are willing and genuinely wanting to move their population forward. Their objectives are much different. It's usually about, it can be about economics of war, it can be about many things, but the bottom line is civilians tend to be pawns in war. They don't tend to be protected in the way that I think wars long ago had been fought along. As well, having interdependent strategies, aligning with authorities, this then gets into difficulty as far as independence is concerned, and then following that impartiality and really being able to make decisions about where the needs are greatest. So from that perspective, I would say that sustainability, it is essentially a political act, both in terms of intention and impact, whereas I would say humanitarian aid in war zones is much more an act that is meant to be apolitical but will have some political impact. So the bottom line is I don't believe that violent settings of oppressive states or war zones are offering the conditions that are conducive to having sustainable action. And I think it's better to simply function on a basis where that's acknowledged, and then programs will be set up in a way that can actually be more impactful according to what is possible. The one thing that has really struck me through the years is that no matter where humanitarian aid is offered, the medical needs always outstrip the capacities. I don't think I've ever seen a situation where the medical needs were possible to meet in their entirety. And this really poses a number of ethical dilemmas for teams. The ethical dilemmas in humanitarian aid are overwhelming. One example that I can give, in South Sudan, at one point I was a medical coordinator. We had a Kala-Azar outbreak, so visceral leishmaniasis, which is a deadly disease caused by a parasite. And we had 4 teams working in different locations. And at one point, it became clear that a drug order that we had placed quite a long time ago was not coming because the pharmaceutical company had changed their drug lines, and we had to wait longer, and they were somehow not willing to switch things around. And we had to decide which locations got the drug, the pentastam, and which ones didn't. And it was such a difficult time to try and figure out how to manage it. And I think under those circumstances, what happens is you go for the least worst option. So it's about using ethics in a way that you recognize that you're in a dilemma situation, which was not hard in that one. And really look at the facts, try to collect as much information as possible, break it down into its components, and then analyze it through the different ethical lenses that you have available, whether it's autonomy, distributive justice, non-malfeasance or beneficence, and then from there try to choose the best option. In this case, we looked at different things. We looked at the security of the teams and the locations, and locations that were more insecure, we were less likely to put drugs there. We looked at the quality of the staff on the ground. Did we have strong enough staff to really follow through with quality programming? We looked at a bit at the power dynamic between the authorities and the organization. Were we in a position that we had solid enough relations that we thought that good quality programming could continue? And by going through all of these things, we did choose which sites we could send the drugs to it. And unfortunately, that meant which sites did not get the drugs. But that's quite a dramatic example. I would say normally, though, in aid, teams are having to make impossible choices all the time. Just in terms of trying to set up a medical program, you can choose to maybe do basic health care, so try to go for the greatest good for the most, or you can choose to do a more comprehensive health service, and serve a smaller population, but really for that population, help them to access their needs. And their choices, and they're difficult choices, because as soon as you choose for one, you're saying no to something else. But that is the reality, and I think the best way to work through it is by taking ethics and using ethics in order to try and make the least worst decision, and realize that there's no right answer. If I were to sum up what I thought the essence of humanitarian aid is, I think it really comes back to the idea of an individual responding to another individual's suffering. And many aid workers will talk about their moral duty, and this duty is characterized by an inability to remain complacent in the face of extreme suffering. It really comes down to an act of solidarity between one human being and another human being. And that's different from more developmental programs where the focus is very much around trying to work with people, but in a systems manner that helps populations and move forward. In terms of solidarity, I can remember a story in Angola. It was in early 2000s when the Angolan war stopped from one day to the next. The rebel leader, Jonas Savimbi, was killed. And with that, all of his generals just put down their arms. They put them down because they could see that their population was not coping, that they weren't able to sustain themselves. And they were in the bush, no one had access to them, and they all started walking to the garrison towns. And as they were walking, many people were dying. They did not have the capacity to cope or to sustain themselves, as I said. This one man came to, we instantly had a massive nutrition crisis on our hand, and this one man came to one of our clinics, and he had his daughter with him, and he asked the team to do whatever they could to save his daughter. And unfortunately, she was too far along, and the team was not able to save her. And when he was leaving, he showed the program manager a picture. And it was a picture of a man and a woman standing in front of a brick house. And they were all dressed up, and their kids were in front of them. And she looked at it, and she almost just passed it back, saying, "Oh, that's nice." And then she looked again, and she realized it was him. And it was the only thing that he had left. It was a picture of him and his family before the war. And what struck us was that the war had stripped him of everything. And then somehow, what kind of role is an aid organization playing in that moment? Because we weren't able to save his daughter. But I do think that the team that was helping him at least helped him to remember the goodness in other people, and helped him to remember that there are humans that do connect for good reasons, and hopefully that gave him something to hold on to as he tried to move forward. In that same crisis, there was another little girl in a feeding center, and she had walked from the bush with her mother, and her mom had died along the way. So she was on her own in this feeding center, and she was quite a character. She used to ask all the international staff to come and sit with her. So I was asked when I came in for a supervisory visit, and I went and sat with her, and she was incredible. She was this tiny little skeleton, but she had so much resolve, and she was somehow so strong in the way that she presented herself that I realized in that moment that we had helped save her. We did save her, but she had so much dignity and so much strength that in fact it was our privilege to have done so. And so it was another moment of solidarity, but one that fortunately worked very well to her advantage. The great thing about this little girl is that in the time that Angola was moving toward peace, and all these nutrition centers were open, the people of the garrison towns were milling through the nutrition centers, looking for their relatives that had been on the other side of the war. And for Inez, her grandparents were milling through, and eventually they linked back up. So it's an example of where this solidarity can really make a difference in somebody's life. So I think I'll leave it there and open the floor. Thank you.
Thank you, Marilyn. That was wonderful. Starting with the word of impartiality, I didn't know how you would be able to bring us into understanding the complexity, but the stories that you were able to share sort of demonstrated yet again the complexity, particularly of impartiality, but also the ethics and the importance of solidarity. All concepts and terms and examples that we've been talking about over the past few days. So I suspect you'll have some questions and discussions. Maybe we'll move on to the next speaker and then we'll take questions afterwards if that's all right for everyone. So we're very fortunate today to have Kathy Bergen join us. She has over 30 years of experience in Israel and Palestine and recently retired from the Friends International Center in Ramallah. And she knows our next speaker, Mustafa, well, and she's going to introduce him for us, and which I think will give us a better light and insight into him. So I'm going to hand the floor. He's going to be joining us by Skype afterwards, and we have a presentation that he's going to do just like we had with Richard. So we're going to watch his presentation, and then he'll, hopefully if all works out well with Skype, he'll be on Skype to answer questions and be participating in the dialogue afterwards. So Kathy?
Thank you. Is this on? I would like to just take a few minutes to introduce Mustafa Barghouti. I've known Mustafa since 1985 when I was living in Jerusalem and working with the Mennonite Central Committee, which some of you may know. At that time, Mustafa had just returned from the Soviet Union, where he had done his studies as a physician. And he and some others, 4 or 5 other doctors, Palestinian doctors, were in the process of establishing a network that became known as the Palestinian Medical Relief Committees. These were primary health care clinics throughout the West Bank and Gaza, and especially this group focused on rural communities where there was no clinic, no health care at all. The Mennonite Central Committee supported the establishment of these, both financially and we gave them a lot of moral support. So I have been fortunate to see those clinics develop over the years. I won't go into any of the details, of course, because Mustafa will talk about that. But I just also want to say that Mustafa has been, he's also an activist. He's a doctor. He's also an activist. In 2005, he ran for president of Palestine. He has also been very much involved as a leader in the nonviolence movement, which is becoming more and more organized in West Bank, Gaza, and also inside Israel. He was Minister of Information in one of the unity governments of the Palestinian Authority. And lately, the past maybe a week or so, he has been one of the key negotiators of a reconciliation between Hamas and Fatah. I regret very much that Mustafa cannot be with us, but we will hear him now, and then he's open to questions afterwards.
Good day to all of you, and thank you for giving me the opportunity to speak at this plenary of Global Health International Ethics. I'd like to start my talk by speaking about general global effect on international health ethics, and then speak specifically about the local situation in Palestine, where I live. And I'd like to start by by giving attention to a very striking fact, which is that seems to be impossible under the global circumstances today. It seems to be impossible for national governments to control the health situation in their respective countries due to the process of globalization and the effect of many global factors. In particular, we see some of these effects on the ground in developing countries. The intellectual property rights, which apply to costing of medications and medical instruments, has had a serious effect on the ability of many countries who don't enjoy high income to provide proper health care to their population. The treatment of many diseases, which are very common, especially in developing countries, are seriously prohibited by the high cost of medications. Another very serious effect has been the global food distribution policies, which has also dramatically affected not only the production cycle in many countries, but also the health status of the people there. A third factor is the spread of consumerism and the effect of the global corporations that have been able to market their products in so many countries, and especially in developing countries, frequently affecting the proper health policies in these places. One very classical example that is frequently mentioned is how much the marketing of milk products, powder milk products, have been affecting the breastfeeding habits and health promotion activities for breastfeeding in many countries, creating thus a lot of health problems for children. In our opinion, because of globalization and the global effect of many economic and social factors, it is impossible for each nation alone today to encounter the negative impact of wrong policies. Efforts go and have to go beyond national state. And that's why I think one of the main conclusions that we've come to is how much we need a global solidarity world movement to deal with many of the health problems. A global solidarity health movement that can deal with issues of laws, global policies, and their effect on different countries. In the case of Palestine, in addition to this effect of the globalization, we have a very specific problem with the long colonialism that has prevailed in this place. The West Bank and Gaza has been under military Israeli occupation for more than 47 years. More than that, the process of colonization has continued since 1948. The impact on health here is very prominent. What we see is that the colonial policies practiced on the ground are affecting the access to land, water, energy, and economic activities. In reality, the Israeli military colonial system is controlling 61% of the land of the small West Bank. Thus, the whole population is incapable of having access or having economic activities or organize proper healthcare in 61% of the land. The colonial power controls 80% of water resources. This reflects on very serious shortage of water among the Palestinian population, which is about 4.2 million people living in the occupied territories. Energy is completely controlled by the colonial power, and that, of course, has a serious impact on the population. The GDP per capita in Israel is $34,000, while the GDP per capita in Palestine, the Palestinian territories, is only 1,400. Yet, the population of Palestine is obliged to pay the same price as Israeli population does, although they make 20 times more income than us. More than that, we are obliged to pay double the price for water and electricity. And if we need treatment in the advanced Israeli medical hospitals, which are definitely much more advanced than Palestinian hospitals, if if we need to refer a patient to an Israeli hospital, we will be obliged to pay 4 times what an Israeli citizen would pay if he doesn't have an insurance. For 35 years, I belong to an organization called Palestinian Medical Relief Society, which has been trying for 35 years to build a health system that serves the population and deals with the impact of occupation, colonialism, but also underdevelopment and classical problems of underdevelopment and underdeveloped countries. During the last 35 years, we built a very good network. We managed to contribute to bringing down the infant mortality rate in Palestine from 150 per thousand about 40 years ago to less than 20 per thousand today. We have a system which is run by the Palestinian government today of vaccination that is considered one of the best in the world in terms of the percentage of population of children who receive vaccination. And although we managed, with the cooperation of all health providers, to build a very good referral system that covers primary and secondary and tertiary health care, there was unfortunate new developments conducted by the Israeli colonial power which destroyed that particular system. By building a wall, which we call the apartheid wall, they managed to destroy the geographic contiguity of the Palestinian communities in the West Bank. From one village to another, a road that used to take 5 minutes now takes 2.5 hours in Salfit area. Hundreds of thousands of people have been besieged behind the wall. Many of them are not allowed to enter or to leave or come back to their communities unless they have permits from the military authority. And if they have permits, they are allowed to enter or leave only during 50 minutes a day. Many people have lost their lives when they had serious medical conditions like heart attacks, or women lost their babies when they were in labor and they were forced to wait in front of the checkpoint or the gate. The unethical practices of the Israeli military army has led to many serious problems. A complete closure of Jerusalem was established, and Palestinian population in the West Bank lost access to the most important tertiary care facilities in Jerusalem, like Maqasid Hospital, or the only ophthalmic hospital in the country, St. John Hospital. Even when ambulances are allowed to transfer a patient from the West Bank into a hospital in Israel or in Jerusalem, they would be forced to practice what they call back-to-back policy, where a patient has to be transferred from one ambulance to another after doing a lot of checkup, and that would take usually long time, which affects, of course, the health condition of people in emergency. 635 military checkpoints are established still in the West Bank, and they prevent freedom of movement, including freedom of movement of medical teams. Most important roads in the West Bank are segregated, and they are exclusive to the use of the Israeli army and Israeli population. This has led to many disasters in terms of prevention of the provision of medical care to people who are in need for it. What we see here in the Palestinian territories by the Israeli army is an act of defiance of international laws, and a country, in particular Israel, is allowed to be impunitive to international law. Even when we criticize this, we face lots of difficulties because of that specific impunity that is granted to the Israeli system. In general, this situation of long-term occupation of 47 years has led also to very serious deterioration in the overall well-being of people. Stress has been a major factor. Violence has affected, of course, people's lives. And the outcome of that is that we have very high percentage of people who have chronic disease like hypertension, diabetes, and heart disease. 30% of people above the age of 30 suffer from high blood pressure. And one of the biggest problems we face is the situation in Gaza, where 1,700,000 people live in a very small area that is only 180 square miles. This is the most densely populated area in the world. Since 2006, the whole Gaza Strip has been besieged by the Israeli army, by land, by sea, and by air. Fishing in the sea is prohibited if people go beyond the range of 5 miles. Supplies are totally controlled. Even food supplies are controlled by the Israeli army. The situation is drastic because we see a situation of complete pollution of water resources. There isn't a place in Gaza where you can have clean water that is not salinated or polluted. Sewage is a big problem. Electricity is available only between 8 and 10 hours a day. Patients are not allowed to leave Gaza Strip with only few exceptions. In reality, besides the global effect on the situation on Palestinian territories, we have also the terrible effect of colonial system that has lasted longer than anybody should have tolerated. In reality, we live in an area where we have 2 laws, 2 systems for 2 people living in the same place, governed by an overriding authority of the Israeli occupation. This is a system of apartheid. That is what apartheid means. A situation where 2 people living in the same place having 2 different laws and 2 different systems. And that's why we hope that part of the work of the Global Solidarity Health Movement would be to demand the application of human rights and international laws to the territories of Palestine, which has become today a state recognized by the United Nations, and that requires the respect of international laws. Thank you.
Thank you. So now we're going to open the floor up to questions. There are the same mics that have been here for the past couple of days, one here, one here. I encourage you not just encourage, I will ask that you introduce yourself and where you're from before bringing forward your questions. Oh, and we have Mustafa online as well.
Yes, hi.
Hello, nice to see you and hear you live.
Thank you. Nice. I hope that the presentation, you got it and it was okay.
We did. We had your presentation. We just finished it, and it was excellent. Thank you very much.
Thank you.
We're just opening the floor up to questions.
Sure, please.
I want to thank all the speakers for wonderful presentations. I want to ask Ms. McHarg, in the wonderful work that MSF does, are there situations where you find that the military can provide you with security without taking over and becoming partial? Or do you always have to keep completely separate?
It's a good question. It's a very complex relationship in that there have been times when the organization has relied on militaries to facilitate evacuations. And somehow that also adds into to the confusion that can exist. But in those moments, I think the organization prioritizes the safety of their staff and then commits to trying to clarify the confusion that can be generated by such a joint act, if you like.
Yeah.
Couple questions about my name is PEGASUS, and I'm originally from the Congo. Couple questions about the NGOs. Can you make some comment about the perception sometimes we have of international NGOs of having one foot on the ground and one foot on the airplane? That's one. And the second, related to, it seems like when NGOs, international NGOs are involved in a given country, the the cost of certain things tend to go up, making it impossible for the local people to buy, to rent, because those NGOs can pay whatever they might be able to, whatever they're asking them. The price can go even 2 or 3 times higher than what used to be. Then the local people have a difficult time accessing housing and so forth.
Thank you. The idea of 1 foot on the ground and 1 foot in the plane, I think you're referring to the fact that when the situation gets really tough, that the NGOs are leaving, or at least temporarily. And it's interesting because from the perspective of somewhere like Canada, aid organizations are seen with they're seen through a lens which is glorified. And I think that it's true that it's important to try and, as much as possible, introduce a transparency about what is possible and what the positive parts of the work is, but also what the downside is, because there are issues that contribute to the downside. And for sure, aid workers are not heroes. They're just people, and the organizations do make a point of trying to keep them safe, and it does mean that when it gets tough, that they're leaving. And I think there's always a commitment to try and get back into situations as quickly as possible, but that disruption that occurs with that can be quite remarkable. I think it's another reason why international organizations need to be clear about what they can and cannot do as far as sustainability is concerned, because when you're going in and out, it isn't possible to have a continuity that's required in the long run. So I would agree with what you're saying on that. As far as costs are concerned, it is one of the downsides. Aid organizations will come in, especially in an unstable setting, they will set up quite quickly, and sometimes organizations will pay what they need to get what they need. And what it means is it can really disrupt the economy. Other ways in which the economies can be disrupted by aid is when there's an influx of food, for instance, and then the food ends up in the markets and it drives down the prices of food, and then that means that the population that's trying to sustain themselves find that they're not able to sell their own food for prices that would have otherwise been possible. So there are these negative side effects, if I can call it that. It's certainly not a side effect for the individuals who have to deal with it, but the point, I think, is for aid organizations and for populations that are supporting aid organizations to try and have a good understanding of the positive, but also the negative, and then to realize that although these things are happening, aid organizations need to show that they understand that it's happening and try to minimize it, and then also be more humble about what it is they can and cannot do.
Thank you, Marilyn. I'm wondering if, Mustafa, would you be able to also respond to the question about the role of NGOs, and particularly in Palestine?
Yeah, absolutely. And I think the issues that were raised are absolutely correct and important. I've been working with different NGOs in Palestine for the last 35 years, maybe, a long time. And I think some of the phenomena that we've experienced here are also experienced in other places. I'm sure that many international NGOs like MSF and others are doing good work, and they contribute positively. But there are certain reservations that have to be taken into consideration. First of all, it is absolutely unacceptable for international NGOs to come and compete with local NGOs. And I think if you want a powerful, strong civil society and good professional input from people at the level of each nation, it is important to strengthen local civil society organizations. That's why some of the best experiences we have with international NGOs like Oxfam Novib, Save the Children, Christian Aid, for instance, is that they work through local NGOs. They don't implement projects themselves. And I think that is a very crucial issue. The second one relates to what also was mentioned here, which is that in no way international NGOs should try to compete with local organizations by competing on the issue of salaries, because definitely they can pay higher salaries. But that can end up in a situation where international NGOs could suck away some of the most important professionals who are working with local organizations. And I think a very important point of any development involvement is to strengthen local organizations and strengthen and empower them. And that's where I think when we speak about relationship between international and local NGOs, we should not speak only about aid and look at it from the perspective of aid, but also look at it from the perspective of empowerment and partnership. It has to be real and serious partnership. And I think international NGOs still don't benefit sufficiently from local expertise in different countries. For instance, here in Palestine, in 2001, we received the World Health Organization Award for the best models we've developed here locally, regardless of the fact that we are under colonialism and occupation. And we've just finished publishing more than 12 different models in managing women's health or care for people with disability through community-based rehabilitation program, or management of non-communicable diseases and their prevention. Or we've created a whole new profession here, the profession of village health workers, which is, I know it exists in other countries, but we run the only college in the Middle East that trains these women health workers. We created a new profession called women's health doctors, who are general practitioners that are trained to provide primary women health care. So I think there is a lot of expertise here which other countries can benefit from, but unfortunately this south-to-south relationship is not really happening as it should be. And I think some international organizations can help a lot in this regard. Thank you.
Great, that's wonderful. There's lineups at the mic. So someone's standing over here, so.
Before I was.
Okay, we'll go 1, 2, and then back to 3. How's that?
All right. Hello, my name is Sunyata Choice. I'm with Project Colors International. And I think this is a really important discussion to be had. And I really wanted to sort of highlight something that Marilyn said, how humanitarian aid is more disaster relief and not necessarily to be looked at on a sustainable level. But let's take the conversation to the next step forward of how maybe can the transition be a little smoother between when we come in with humanitarian aid, and then build the capacity afterwards of the locals to carry on. I saw this in Sri Lanka with my work there with the Tamil people, and it was after the tsunami. And there was an amazing outreach from the world after the tsunami helping in Sri Lanka. The NGOs, however, weren't necessarily working together. Too much money was focused in all at once. The capacity wasn't there to deal with that much money, and it was being spent, unfortunately, in some areas that weren't needed quite as much as others, so it wasn't sustainable. So what I saw working with the women's groups afterwards is many vehicles were left unattended, they couldn't be maintained, the small NGOs couldn't pay for the gas for them, there's buildings that were falling apart, and many buildings that actually the local groups were then arguing over who really owns these establishments and what are we going to do with them, so they ended up being dilapidated. So one of the things that I found from the local people that when I asked in review, what would have you done differently? They did say that there should have been more of a transition to build their capacity to fall into the roles to carry on the work that the aid workers were doing as well. And the money should have been stretched out over a longer period of time and not just condensed all at once in buying stuff, but actually bring in the training for the local people to carry on the work. So I guess my question is, do you have any other examples of how that transition could possibly come arise that we could all learn from those experiences, even small practical ways that could be implemented.
The mic is not working on this side.
Oh, there it is. It's a great question because I'm presenting things in a black and white way, and the reality is it's pretty much all gray. And by being very sort of categorizing things in the way that I have, I find it helps just to have a clarity that can then help in decision making and knowing and understanding where roles start and stop. But there is this huge transition phase that you're talking about when a country shifts from an acute crisis to one that's more chronic in nature or has moments of acute episodes, and it's a dilemma because the mindset that you need to respond to an acute crisis is very much different from one in which you are trying to build something. The organization I'm with now, Dignitas International, we've been working in Malawi for 10 years, and we came in when the HIV/AIDS crisis was just gutting the country, and I mean 70% of the people dying in hospitals were dying of HIV/AIDS related diseases. There was maybe 500, I heard 500 people on antiretroviral therapy when it first started, or when we first started there, and what we did was, in fact, the organization Dignitas International was born out of a few MSF people, and there's a number of MSF people still in the organization, but people who are very interested in trying to work in these transitional settings. And what we've managed to do is to help see through the crises in a way that we have a much longer term commitment. I think that's one thing that's required. We work hand in hand with the Ministry of Health. We really try to be working as a partner, not coming in and doing, but really working alongside. And we use research. We're very much focused on doing some direct patient care, mostly system strengthening, and then researching on an operational basis, and then taking that empirical information and trying to influence policy. And that combination of activities we have in a balance and do alongside the Ministry of Health in a way that we're hoping that as we continue the relationship, that bit by bit this model of learning will be something that becomes very much integrated into the Malawian Ministry of Health. And we're just working in that one country right now, and the idea is that we'll focus there, we'll be small, we'll really try to make a difference, and then through the policy side, we'll have a much broader impact moving forward. We'll see how it goes. We've only done our first 10 years, but the commitment's there to continue and to really try and balance research, operations, and knowledge translation in a way that we hopefully help to embed strong learning in the system and move it forward.
Great. Next question.
Hi, my name's Joel Walker, retired psychiatrist, photographer from Toronto. Mustafa, is there a way that the Israelis and the Palestinians can begin to help each other, whether through global health or rather than it being so on one side and so on the other side, you know, where your feelings were very, very strong as you expressed your views about the colonization and how you feel you're being treated and everything. But there must be a better good for both sides of trying to work together to really improve the health where it would be rewarding for both countries.
Can I answer?
Yes, you can.
Thank you. Well, thank you. This is a very good question. As a matter of fact, of course, my presentation had to be restricted to a certain amount of time, so there were many things I could not explain and mention. But thank you for this question because it relates to one of them. As a matter of fact, we have been working since 1984 with another organization, an Israeli organization called Physicians for Human Rights. And we actually helped establish this organization because our own organization, Medical Relief Society, was established in 1979. And following our model or example, a wonderful group of Israeli physicians decided to create the Physicians for Human Rights in Israel. And we attended their first founding conference. And since then, we've been cooperating very well together, organizing joint mobile clinics, organizing joint activities. Most recently, we've organized the examination and then distribution of 5,000 hearing aids to people who are in need for them in cooperation with an American organization in the United States called Starkey. And these kinds of joint activities have been very fruitful, but you see this cooperation is based on this organization, the Physicians for Human Rights in Israel, totally adopting the right approach of demanding the freedom for Palestinian people. So what we do together is not about normalizing the system of colonialism and occupation, but it's about resisting it. And that's why we did many joint statements about the aggression against the people in Gaza, for instance. We organized jointly a delegation that came from, different countries of the world to examine the atrocities and crimes that were conducted in Gaza during the Israeli attack on the population there. So there are very good examples of wonderful cooperation with many Israeli physicians and people who believe in the right approach and who believe that healthcare should be accessible to everybody on the basis of human rights. But on the other hand, there is another issue I would like to attract your attention to. Unfortunately, frequently, the Palestinian-Israeli issue is presented worldwide by the media as if it's a conflict between two sides that are equally guilty or equally responsible. And what we need is just a mediation between these two groups to make them coexist and live together. I think this kind of presentation is absolutely incorrect. Because we are talking, and let me tell you here, nothing from what I told you in my presentation or from what I'm telling you today negates or ignores the suffering of people in history, whether in the pogroms of Russia or during the Holocaust or during the Inquisition time in Spain or in other times. But all this suffering of the Jewish population in many parts of the world, all of that never happened. Had nothing to do with Palestinians, which I mean that Palestinians had never participated in any form of oppression of the Jewish population. On the contrary, in Palestine, we coexisted and lived together, although the Jewish community was much smaller and was a minority in Palestine. The problem today is different. The problem today is, unfortunately, you cannot equate between the Israeli side and the Palestinian side, because you cannot equate between an oppressor and an oppressed. You cannot equate between a system that is practicing apartheid and another people who are victims of this apartheid. That's why I think we need here to introduce the concept of solidarity. And when I say solidarity with Palestinian people and demanding the end of occupation and colonialism, this is not going to be for the sake only of Palestinians. That's what we tell Israeli people when we encounter them in different forms. We tell them we are struggling as Palestinians, non-violently and peacefully. That's what we advocate, to end the system of apartheid and occupation, because the Israelis themselves will not be free unless we are free. So we are struggling for the future of both people. And there is nothing in our struggle that negates the future of Israelis or denies them the right to exist and continue to live. But we say that the continuation of occupation and apartheid and injustice is the main enemy of the future of both people. And that's why when we speak about the situation here, it's very important not to equate between the two sides, because you could not have equated between those who practiced apartheid in South Africa and the people of Nelson Mandela who struggled against apartheid. Thank you.
Thank you. There was a gentleman sitting down that was a step ahead of you.
I'm okay. I'm going to defer to the other questioners for now.
Are you sure? Okay.
So, Dr. Barghouti, I just want to follow up really on the last point that you were making there. I think there is no doubt that you are suffering from an apartheid system in Palestine. And as I'm sure you know, many of us here in Canada are opposed to our present government's pro-Israeli position. Whilst we are encouraged by the recent reconciliation between the two governments in Palestine, we are disheartened by the suspension of the peace process. We understand because of the Israeli reaction to the policies of Hamas. What do you see as the way ahead?
Thank you. Well, I was myself one of the 5 people who went to Gaza to mediate between the two governments in Gaza and West Bank. And I've been doing this also for a long time. And I was one of those who mediated between them to create the National Unity Government in 2007. And our most recent trip to Gaza resulted in a good agreement that hopefully will end this internal division between Palestinians. And we think this is very important for the future of peace. Because for a very long time, Mr. Netanyahu, the Prime Minister of the Israeli government, which is unfortunately one of the most extreme in the history of Israel, has been always saying that he cannot make peace with Palestinians because there is nobody that could represent them all. Because of the internal division. And unfortunately, after we declared our unity or the intention of creating unity, he came up and said, because of unity, we cannot make peace with Palestinians. Of course, he's wrong, because in my opinion, first of all, he has to choose whether he wants us divided or unified. In each case, he still says he doesn't want to make peace with us. But I think what we've done is very important from the perspective of reducing the human suffering, especially for people in Gaza, which I have described to you. Second, it's very good because it makes the possibility of peace more achievable, because any future agreement that will be done will be done with all Palestinians and not with part of them. And third, and this is something that is not sufficiently mentioned in the media, this agreement is about bringing back our democracy, which we've lost because of the internal division. We've lost the role of our parliament. We ended up having a concentration of power both in West Bank and Gaza in an executive authority. We lost the system of pluralism and participation. And I personally believe that the only peace that will last in the long run is the one between democracies. And that's why it's so important to make Palestine a democracy. And that's why this unity agreement is important. Regarding the negotiations with Israel, as you know, Mr. Kerry, the State Secretary of the United States, has been mediating, and he has done so many trips. He had 40 meetings during the last 9 months with the Palestinian and Israeli leaders. And for effort, he deserves an A+. Unfortunately, he could not reach an agreement, mainly because of the stubbornness of the Israeli government, mainly because this Israeli government insists to continue illegal settlement activities in the occupied territories and refuses to recognize the right of Palestinians for sovereign, independent Palestinian state, although it would be a small one on less than 22% of the land of historic Palestine. Mr. Kerry promised that within 9 months he would deliver an agreement about all final status issues, but he was dragged into a vicious cycle by the Israeli government. So what he promised to be an agreement about final status became a framework for the solution, and then it became a framework for negotiations, and then it became negotiations about the framework, and eventually we ended up having negotiations about negotiations. This is a vicious cycle that was created, and unfortunately Mr. Kerry is finding difficulty pressuring Israel because of the strength of the lobby, because of the positions in the Congress. But everybody in the world realizes that without changing the balance of power, and that's where international intervention is needed, we cannot reach an agreement. So we want peace. We want true peaceful negotiations to take place. But definitely we cannot have negotiations while Israel continue to build facts on the ground and build illegal settlements, which would undermine the possibility of two-state solution. That's where things stand today. And I do hope that we could maybe develop some kind of international framework where the whole international community would be involved, including the UN and other parties, and it would not be exclusive United States supervision, because the United States is finding great difficulty being a mediator and being biased to Israel at the same time. Thank you. And sorry for the long answer.
Okay.
Thank you. One of the unfortunate jobs you have as moderator is bringing things to a close when the conversation is really starting to bubble and to grow. I want to thank our panelists, Marilyn for joining us, Kathy as well, and Mustafa for being able to come in on Skype and also taking the time to do the presentation ahead of time, as well as Richard, who took the time to put the presentation together. I feel that they've given us a very strong start to a Sunday morning with lots of issues that we've talked about over the past few days and will continue to in the breakout sessions this morning. So grab some coffee. Is there coffee? Yep, grab some coffee and continue the conversations. Mustafa, we're sorry you're not here with us. You're with us in spirit, and I'm sure that your presentation and comments will be continuing to be discussed throughout the rest of the day. So thank you to everyone, and enjoy the rest of the day. Thank you.
Thank you.